Welcome to the Module 2 on Public Health Education for Community Health Workers. Let's start with a simple question. What is a vector? A vector is a living organism that carries and spreads diseases from one person or animal to another. Usually, these are insects like mosquitoes, sandflies, or ticks. When these insects bite a person or an animal which is infected, they pick up the germs. Then, when they bite the next person, they pass the infection on. That's how vector-borne diseases spread. Now let's look at the most common vector-borne diseases you might see in your area. The examples include malaria, which is spread by female Anopheles mosquito, and the main symptoms include fever with chills, sweating, weakness. Another example is dengue, which is spread by Aedes mosquito. Symptoms include high fever, body pain, rash, and joint pain. Another example is chikungunya, which is also spread by Aedes. The next example is Japanese encephalitis, which is spread by Culex mosquito. Symptoms include fever, headache, vomiting, and confusion. Another example is Kala-Azar. Main symptoms include long fever, weight loss, and enlarged spleen. Another example is lymphatic filariasis, which is spread by Culex mosquito, and the symptoms include swelling of limbs, fever, and disability. Let's understand where these disease-carrying insects come from. Mosquitoes breed in coolers, pots, open tanks, discarded tires, or coconut shells. Sandflies breed in dark, damp areas or cracks in walls. Ticks and fleas live on animals and in dirty surroundings. So, controlling their breeding is the most important prevention step. Let's talk about simple, practical steps you can teach families in your community. These include removing breeding sites. Do not allow water to collect around houses. Protect from bites. Use mosquito nets while sleeping. Wear full sleeves clothes and apply mosquito repellent creams. Community actions include covering drains and disposing garbage properly, keeping surroundings clean and dry, keeping cattle sheds clean, removing animal waste properly. If you find someone with fever lasting more than 2 days, headache, body ache or joint pain, or rashes, vomiting or confusion, you should inform the primary health care immediately. Now let us learn to identify mosquito vectors including Aedes, Anopheles, and Culex, the most common vectors which spread diseases in India such as dengue, chikungunya, Zika, malaria, Japanese encephalitis, and filariasis. All mosquitoes have 4 life stages. When the male and female mosquitoes mate, the female mosquitoes lays eggs on or near water. The next stage is larvae. These are tiny wiggling organisms seen moving in water. They feed on dirt and need oxygen from the surface. The next stage is pupae. These are the resting stage before they become adults. They float near the surface of water. The next stage is adult, where the female mosquitoes start biting for blood to produce eggs again. These entire life cycle can take just 7 to 10 days. Let's start by identifying adult mosquitoes. The Aedes mosquitoes have black and white stripes on their bodies and look like tiger mosquitoes. They breed in clean water, such as flower pots, water tanks, buckets, and coolers. They are daytime biter and spread diseases such as dengue, chikungunya, and Zika. Anopheles mosquitoes appear brownish and they rest at an angle. Generally, body is raised, and they breed in clean or slightly muddy water, in ponds, in paddy fields. They are night biters and spread diseases such as malaria. Culex mosquitoes have dull, brownish bodies and rest flat on the water surface, similar to Aedes. Their breeding places include dirty or stagnant water, such as drains or septic tanks. They are night biters and spread diseases such as filariasis and Japanese encephalitis. The mosquito species can also be identified at larval stages. Each type looks and behaves differently in water. Aedes larvae, they are found in clean water and are active and restless and move quickly. They hang at an angle from the surface with their head down and tail up. They have a short siphon, which is the breathing tube. Anopheles larvae are found in clean and natural water bodies. They lie flat on the surface with no siphon or breathing tube. They breathe directly through spiracles on their back and move slowly with a gliding motion. Culex larvae are found in dirty or polluted water and hang vertically from the surface of water with their head down and tail up. They have a long siphon or breathing tube and move moderately fast. You can also distinguish the eggs of these mosquitoes. The Anopheles eggs appear brownish and separated. Aedes eggs are darker and are also separated, whereas Culex eggs are laid as clump called as egg raft. Let us look closely at some of the diseases and their common symptoms spread by these mosquitoes. Aedes mosquito diseases include dengue. The symptoms are high fever, severe headache, joint and muscle pain, sometimes rash and bleeding gums and nose. Chikungunya, symptoms include fever with severe joint pain and swelling. And Zika, which shows symptoms such as mild fever, rash, and red eyes. And it is very dangerous during pregnancy. Anopheles mosquito disease include malaria, which presents with fever with chills, sweating, headache, vomiting, and fever often comes in cycles. Culex mosquito disease include filariasis, which is swelling of legs, scrotum or breast, fever, and repeated infection. And Japanese encephalitis, where the symptoms include fever, headache, confusion, and sometimes fits, especially in children. Now let's talk about what we and our communities can do to stop mosquitoes from breeding and biting. The actionable measures for prevention, treatment, and resource management include regular weekly cleaning of containers, covering all water storage, using bed nets, repellents, and screening windows for prevention. Refer suspected cases of fever, body pain, and swelling to the nearest primary healthcare center. Ensure blood tests for malaria and dengue. Support patient follow-ups and completion of treatments. Coordinate with other health workers and community leaders for fogging and awareness drives. Keep a record of reported fever cases and mosquito breeding sites, and help distribute mosquito nets and education materials for resource management. Remember, awareness and preventions are the best tools we have. Let's go over what we have learned so far. You can make small notes in your notebook and look at them later. Let us answer this. What is a vector? Which mosquito spreads dengue? Where do Aedes mosquitoes breed? Name one preventive measure for vector-borne diseases. And last, what should you do when you find a fever case in your locality? Next, we will see you in Module 3, where we will learn about some of the diseases which are prolonged and are difficult to diagnose, known as pyrexia or fever of unknown origins. In addition, we will learn about some of the important zoonotic diseases whose prevention is necessary. Thank you for your participation. and let's continue this educational journey.